Aloha and welcome to our pre-retirement health benefits workshop. The training is designed to give you some very important information about EUTF health benefits for employees thinking about retiring from the state or county. This presentation is a brief summary and does not constitute a legal document or contract and is subject to change. Topics for today include applying for retirement, eligibility, health plan options, employer contribution, Medicare, retiree enrollment, and making changes. Applying for retirement. Once you file for retirement with the Employees Retirement System or ERS, you will be given an ERS Retirement Estimate Letter. A copy of this letter must be submitted to the EUTF showing your name, retirement date, years of service, and ERS membership date in order for EUTF to begin the process of enrolling you in EUTF retirement benefits. Retiree enrollment. EC2 enrollment forms are available on our website at eutf.hawaii.gov. Please complete all sections of the EC2 enrollment form. The EC2 form must be submitted within 60 days of your retirement date. Submit your EC2 form and required supporting documents to the EUTF at EUTF 201 Merchant Street, Suite 1700, Honolulu, Hawaii 96813. A benefit enrollment confirmation statement will be mailed to the retiree's address once the enrollment is processed. Please review and report any errors to the EUTF immediately. Keep for your records if everything is accurate. Eligibility for EUTF retiree benefits include a retired employee. Please keep in mind that you do not need to be covered under an EUTF active employee plan at the time of retirement to be eligible to enroll in EUTF retiree plans. Also, if you return to work for either the state or county after you have already retired, you must inform ERS and EUTF. Also eligible is the retiree spouse or partner, either domestic or civil union, and also eligible is the children of the retiree spouse, or the retiree's partner, and these are children by either birth, adoption, legal guardianship, or foster child. Dependent children are eligible for medical, prescription drug, dental, and vision plans. Dependents will lose eligibility and coverage as of the first of the month following their 26th birthday. Legal guardianship or foster children will terminate upon reaching the age of 18. And coverage can be continued for an unmarried child beyond age 26 who is incapable of self-support due to a mental or physical incapacity that existed prior to the age of 19. Coverage ends once the child's parents are deceased or no longer eligible. Eligibility survivor benefits. Also eligible is a surviving spouse, domestic, or civil union partner of a deceased retired employee, provided the spouse or partner does not remarry or enter into another domestic or civil union partnership, as well as the unmarried child of a deceased retired employee. Coverage can continue with no surviving parent able to enroll them in an EUTF plan and will terminate on the first day of the month following the child's 26th birthday. Dual enrollment. Hawaii revised statutes specify that if both you and your spouse or partner are employees and or retirees of the state or counties, the employer contribution cannot exceed the family plan contribution. Children cannot be enrolled by more than one employee or retiree beneficiary. EUTF retiree health plan options include for medical, HMSA 9010 PPO plan, Humana Medicare Advantage, Medicare Part A and B required, or Kaiser Permanente HMO medical plan and Senior Advantage plan. For prescription drug, CVS Caremark and SilverScript, or Kaiser Permanente prescription drug. Dental and vision include Hawaii Dental Service and Vision Service Plan. And for life insurance, Security and Financial. HMSA's PPO 9010 plan offers members a 10% coinsurance for office visits and hospitalization, and a 20% coinsurance for diagnostic lab and x-ray services. Deductibles only apply when services are received from out-of-network providers, and the maximum out-of-pocket is $2,500 per individual or $7,500 per family. The maximum out-of-pocket is your financial protection against a catastrophic injury or illness. Once you've reached the dollar maximums in out-of-pocket coinsurance, co-payments, or deductibles, your plan benefits will increase to 100% for covered expenses for the remainder of the calendar year, excluding taxes. The MOOP is a calendar year benefit that resets every new plan year beginning January 1st. Please keep in mind, if a retiree and any covered dependents under the HMSA 9010 plan is enrolled in Medicare's Parts A and B, he or she will likely pay no coinsurance or co-payments for covered services after applicable Medicare deductibles are satisfied. Humana Medicare Advantage PPO plan is available only to those enrolled in Medicare Parts A and B. This plan offers 90% coverage for most services with 10% coinsurance. There is a $100 annual deductible per person for selective services. Benefits include 10% coinsurance for primary care office visits and hospitalization, not subject to the deductible, and a 10% coinsurance for diagnostic lab and x-ray, which is subject to the deductible. The maximum out-of-pocket benefit is $2,500 per individual. Please keep in mind, under the Humana Medicare Advantage plan, there is no coordination of benefits with original Medicare. The Kaiser Permanente HMO medical plans is comparable with the Kaiser Comprehensive plan available to active employees. There are no deductibles. Primary care office visit co-payments are $15, and inpatient hospitalization is covered at no charge. The maximum out-of-pocket is $2,000 per individual or $6,000 per family. Retirees under Kaiser who become Medicare eligible must enroll in a Kaiser Senior Advantage plan unless living in Kauai, Molokai, Lanai, and parts of Hawaii Island including Pahala, Naalehu, and Hawaii Volcanoes National Park. EUTF prescription drug coverage includes benefit types for non-Medicare under CVS Caremark or Kaiser prescription drug plan, and Medicare prescription drug plans under SilverScript and Kaiser. Plans include equal to or lower co-payments when compared to prescription drug coverage under EUTF active plans. The dental plan is provided by Hawaii Dental Services, also known as HDS. Diagnostic and preventive services such as exams and cleanings are covered at 100%. Other services such as fillings are covered at 80%. The plan year maximum per person is $2,000 with a $50 annual deductible per person. Vision is offered through Vision Service Plan or VSP and includes an annual eye exam with a $10 copayment. Prescription lenses or contacts are covered every year. Frames are covered every other year. If you elect glasses, your copayment is $25 for the lens and $150 allowance for the frames. If you elect contacts, your allowance is up to $130 towards contact lenses and the fitting and evaluation. Life insurance is offered through Security and Financial for the retiree only, up to $1,487. This benefit is 100% employer paid. Differences between the EUTF active and retiree benefits. Prescription drug benefit, lower co-payments under the CVS Caremark retiree prescription drug plans. Generic co-payments equal to or lower under the Kaiser active plans, but lower for brand and specialty prescription drugs under the Kaiser retiree plans. Please see the active and retiree reference guides at eutf.hawaii.gov. Chiropractic benefits not offered under the retiree plans. Dental benefits. Active plan, limited orthodontic benefits at 50%. Retiree plan, no orthodontic benefits. Medicare Part B, active plan. Eligible employees and dependents are not required to enroll in Medicare Part B. Retiree plan. Eligible retirees and dependents, including disabled children, are required to enroll in Medicare Part B for coverage under the retiree medical and prescription drug plans. Retirees and spouse will be reimbursed for the Medicare Part B premiums. Non-spouse dependents are not reimbursed for the Medicare Part B premiums. As active employees, the portion of health coverage costs paid by the employer is negotiated within the collective bargaining process. As a retired employee beneficiary, the portion of health coverage costs paid by the employer is determined by law. In this section, we will explain how the employer contribution towards health plan premiums is determined for retirees. Base monthly contribution, or BMC. The following table shows the base monthly contribution for 2025. The base monthly contribution is your employer's maximum allowable contribution towards your EUTF retiree health plans and is listed under non-Medicare retirees for single, two-party, or family, and Medicare eligible retirees, single, two-party, or family. The BMC amounts may be adjusted every January 1st and is based on Medicare Part B premium increase or decrease. Employer contribution determination. The employer premium contribution is determined by statutes and is based on three factors: the employee's ERS membership date, length of service, taking into account any breaks in service, and base monthly contribution, or BMC. Employer contribution table. This chart displays the percentage of the base monthly contribution your employer will pay for your premiums. Take a look at the chart and see where you fall. On the top row, find your ERS membership date, and on the far left column, your years of credited service. You will fall in either the 0%, 50%, 75%, or 100% categories. Keep in mind that if your ERS membership date was on or after July 1st, 2001, the monthly employer-sponsored contribution will be calculated on the base monthly contribution for self-rate only. You may obtain coverage for eligible dependents, but you will be responsible for the difference in premium costs. Health plan premium costs and employer contribution comparison. The region in green shows the monthly health plan premium costs for medical coverage options that include Humana, Kaiser, and HMSA. Premiums are shown for retirees enrolled in Medicare and non-Medicare, for self, two-party, or family. Please note that the premium amounts listed include medical, prescription drug, dental, and vision. The region in gray shows the employer contribution for Medicare and non-Medicare retirees at 100% base monthly contribution, 75% BMC, and 50% BMC under self, two-party, or family. For example, a retiree under Medicare enrolled in self-only HMSA, prescription drug, dental, and vision has a monthly premium shown here. If the retiree's base monthly contribution is at 100%, the BMC amount will offset the monthly premium, which results in the retiree having no premium costs for their EUTF benefit elections. The EUTF premium calculator for retirees is available on our website at eutf.hawaii.gov and can provide retirees estimates on monthly premium costs based on plan selected, membership start date, and length of service. The premium calculator for retirees covers a variety of plan and contribution scenarios. Please keep in mind that the EUTF premium calculator for retirees provide unofficial estimates only, as final calculations are determined by the EUTF. Reoccurring electronic premium deduction requirement. If you're responsible for paying a portion of your or your dependent's monthly health benefits premium, you are required to enroll in a recurring electronic premium deduction. The EUTF offers two options. ERS pension deduction. Opt for premium deductions directly from your ERS pension, or ACH deduction. Set up an automatic deduction from your bank account. Enrollment forms for ACH or ERS pension deduction are available on our website at eutf.hawaii.gov. What is Medicare? Medicare is a federal health insurance program offered through Social Security for U.S. citizens and legal residents who are age 65 or older, or those younger than age 65 that qualify due to a disability. Medicare benefits are divided into four parts. Part A, hospital, and Part B, medical. Parts A and B of Medicare are also known as Original Medicare. Medicare Part C, also known as Medicare Advantage, is the federal Medicare program offered through a private insurance company. Medicare Part C includes Original Medicare and sometimes Medicare Part D along with additional benefits. Medicare Part D is prescription drug coverage. Retirees eligible for Medicare Part B. Retirees eligible for Medicare Part B must enroll in Medicare Part B when they become eligible in order to be enrolled in the EUTF Retiree Medical and/or Prescription Drug Plan. Covered dependents eligible for Medicare Part B, including a retiree spouse, domestic partner, civil union partner, or a disabled dependent, must also enroll in Medicare Part B when they become eligible, regardless of whether they are retired or actively employed, if enrolled in the EUTF Retiree Medical and/or Prescription Drug Plan. Please keep in mind that you must provide the EUTF with proof of your Medicare Part B enrollment within 60 days of becoming eligible or enrolling into an EUTF Retiree Medical and/or Prescription Drug Plan. Please submit a copy of your and/or your dependent Medicare card. Remember that mandatory Medicare enrollment for Part B only applies if you or your spouse or partner will be enrolling in EUTF medical and/or prescription drug plans. If you are only enrolling in dental and vision plans, then mandatory Medicare Part B enrollment does not apply. Medicare enrollment. Contact the Social Security Administration at least 3 months prior to your 65th birthday or retirement to enroll in Medicare Part B. You can enroll in person, call Social Security, online, or by mail. If you are receiving Social Security benefits, which becomes possible from age 62, you will automatically be enrolled in Medicare's Parts A and B when you turn 65. If you're not collecting Social Security, you must take the initiative to enroll in Medicare. Medicare Part B monthly premium rates. This chart illustrates the standard monthly Medicare Part B premium amount for this year, in yellow, as well as Social Security's income-related monthly adjustment amount, or IRMA, for high-income Medicare beneficiaries who pay above the standard Part B premium. In order to determine the beneficiary's monthly Medicare Part B premium for a given year, Social Security does a 2-year look-back into the gross adjusted income taxes filed by the beneficiary. A beneficiary's monthly Part B premium will depend on where they fall on this chart, with the majority of Medicare beneficiaries falling under the standard Part B premium, along with a small number of beneficiaries falling above the standard range. As part of your retirement benefits, retirees who pay a monthly Medicare Part B premium, and for those who qualify, their eligible spouse or partner, will receive 100% reimbursement of the Medicare Part B premium, whether they are paying the standard premium amount or if they are paying above the standard premium amount. Please note that Medicare Part B premium reimbursement is available whether or not the retiree enrolls in EUTF health plans, and allows for 100% Medicare Part B reimbursement regardless of the retiree's employer contribution. Medicare Part B premium reimbursement. Reimbursement eligibility for retirees. Quarterly Medicare Part B premium reimbursement is available for the following individuals: Retirees hired prior to July 1st, 2023, and their spouse or partner who are enrolled in Medicare Part B and are paying Medicare Part B premiums, including income-related monthly adjustment amount or IRMA, are eligible for Medicare Part B premium reimbursements, excluding penalties. Retirees hired on or after July 1, 2023 who are enrolled in Medicare Part B and are paying Medicare Part B premiums are eligible for Medicare Part B premium reimbursements, excluding penalties and IRMA. Spouse or partners are not eligible for reimbursements of their Medicare Part B premium. Individuals ineligible for reimbursement. There will be no reimbursement for beneficiaries who do not pay a Medicare Part B premium. Examples: enrolled in the Medicare Savings Program or Medicaid. Direct Deposit Agreement Form for Medicare Part B reimbursement. Retirees must complete the Medicare Part B Premium Reimbursement and Direct Deposit Agreement form in order to receive Medicare Part B reimbursement. This form is available on our website at eutf.hawaii.gov. Premiums are reimbursed quarterly and are direct deposited into the retiree's account. When completing the Direct Deposit Agreement form for checking accounts, please submit a voided check. For savings accounts, the form must be signed by your bank. Medicare Part B Premium Proof of Payment. Please submit a copy of the Social Security Administration letter or SSA letter or billing invoice indicating your Medicare Part B premium amount. Medicare retirees and or dependents that pay a higher income-related monthly adjusted premium must submit a copy of their SSA letter to the EUTF each year. Retirees must submit proof of enrollment in Medicare Part B, direct deposit agreement form for Medicare Part B reimbursement, and proof of payment to the Social Security Administration or Centers for Medicare and Medicaid Services. Reimbursement will be effective the latter of effective date of Medicare Part B coverage or first day of the month EUTF receives proof of enrollment in Medicare Part B and a valid direct deposit agreement form. In addition, proof of payment to the Social Security Administration or Centers for Medicare and Medicaid Services is required to begin Medicare Part B reimbursements. Please be advised, EUTF does not reimburse penalties or Medicare Part D premiums. Enrollment into EUTF Medicare Part C and Part D plans. EUTF Medicare Part C and Part D plan options requiring Medicare enrollment include EUTF Kaiser Senior Advantage Plan, Humana Group Medicare Advantage PPO Plan, and EUTF SilverScript Medicare Part D Prescription Drug Plan. Medicare requires that you are enrolled in only one Medicare Part D or Medicare Advantage plan. If in the future you enroll in a non-EUTF Medicare Advantage or Medicare Part D plan, you may be disenrolled from EUTF's Kaiser Senior Advantage Plan, Humana Group Medicare Advantage Plan, and or SilverScript Medicare Part D Prescription Drug Plan. The EUTF Medicare plan enrollment may take approximately 45 days for Medicare approval. For EUTF SilverScript Prescription Drug Plan enrollees, members will receive a temporary CVS prescription drug card upon initial enrollment to use until approval is finalized. A SilverScript prescription drug card will be issued to replace the CVS prescription drug card following Medicare approval. In most cases, enrollment into EUTF Medicare plan options can only be done prospectively. Therefore, enrollees are requested to submit their enrollment as soon as possible to help ensure plans begin on the date of retirement. Pre-retirement checklist. The pre-retirement checklist is designed to help you complete the necessary forms needed to enroll in your EUTF retiree health and life insurance benefits. Forms may be found on the EUTF website at eutf.hawaii.gov/EUTF-forms. You will need to contact your employer, HR, or for DOE employees, your school administration, notifying them that you will be retiring. Your employer will then notify EUTF and forward your close of business date. Be advised that without this notification from your employer, we will not be able to enroll you in EUTF retiree plans. After filing your retirement application with the Employees Retirement System, or ERS, please submit the following to the EUTF. Pages of the ERS Retirement Estimate Letter that reflect ERS membership date and total years of service. Please only submit the page or pages requested above which pertains to the EUTF. All other pages will be destroyed. A completed and signed EC2 enrollment form. If you will be Medicare eligible at the time of retirement, either reaching age 65 or qualified disabled, you must also submit a copy of your and/or your dependent's Medicare card indicating enrollment in Medicare Part B, Medicare Part B reimbursement direct deposit agreement form, an avoided check if designating a checking account, and Social Security Administration letter or some invoice from Social Security for you and/or your dependent indicating the Medicare Part B premium monthly amount. If you're adding a dependent for the first time, you must also submit a marriage certificate or birth certificate. If you will be paying all or a portion of your health benefits premiums, you must enroll in one of the automatic premium deduction options, either the ERS pension or the ACH deduction authorization forms. Retiree enrollment confirmation forms are mailed out to the retiree's address once enrollment is processed. Please review and report any errors to the EUTF immediately. COBRA extension of benefits will be mailed out to retirees previously enrolled on active EUTF health plans. Qualifying events allow retirees to make certain changes to their benefit elections during the year. Examples of qualifying events include marriage, divorce, death, loss of coverage, disenrolled due to enrollment in other coverage, geographic relocation, as well as adding or dropping dependents. Qualifying event notification. If you experience a qualifying event and wish to make changes to your plan, complete an EC2 enrollment form available online at eutf.hawaii.gov. Be sure to notify the EUTF within 45 days of your qualifying event. Exceptions to the 45-day deadline include retirement, 60 days, disenrolled due to enrollment in other coverage, 90 days, and birth, 180 days. Submit required supporting documents with EC2 form and be sure to contact EUTF if supporting documents will take longer than the deadline. Open enrollment allows retirees to make changes to their benefit elections annually. During the open enrollment election period, retirees can add, change, or drop a plan, add or remove dependents, and change coverage tiers, such as changing from self to family or family to two-party. The open enrollment election period normally occurs in the month of October, with new coverage and premium rates becoming effective January 1st. The plan year for retirees is from January 1st to December 31st. Online resources available for retirement at eutf.hawaii.gov include the EUTF Retiree Health Benefits Highlights Guide, our pre-retirement checklist, our Medicare checklist, as well as resources on Medicare and other required documents located under the Learning Center tab's Thinking of Retiring heading. This concludes our session for today. We hope that the information provided has been informative and helpful. Mahalo from the EUTF for your time and attention.